And I think we are now live, dear viewers, and thank you so much for watching this presentation. And this is a great pleasure to have you all here. I have to apologize to our viewers because by mistake, the last streaming was done in the Digital Health Portugal channel, not in the Health Data Forum channel, but we'll fix that by swapping videos later on. I hope that in the social networks you'll be finding us anyway, because I've shared already the stream on the relevant channels. Apologize for that, but now we are in the correct channel, in the Health Data Forum channel, and this is a preliminary event for the Global Summit we'll be hosting in the city of Porto. I have here with me the reminder of guest panelists that joined for the day session. Andrea Collard on alphabetical order, Arthur Olesh and Ricardo João Correia, that I will be giving them the floor momentarily. I have also here with us a guest, a dear friend and former speaker of Health Data Forum Global Summit 2020, Gerard de Bourbon. Gerard is from the INL, the International Nanotechnology Laboratory. It's probably the sole exclusively research laboratory dedicated to nanotechnology. So it's really a fortune to have INL based in Portugal. It's not a Portuguese laboratory, it's an Iberian organization, one of the few Iberian organizations that I know, founded by both Portuguese and Spanish governments. It's located in Braga, and Gerard Bourbon is a special projects manager in that organization. And he has been with us in Health Data Forum last year. Already Gerard in the ideation session has presented thoughtful comments here. So I'm sure our viewers here and this live broadcast will benefit from our live conversation, our fireside chat conversation now. And just for a quick reminder of what is going to be the Health Data Forum, I'm going to share with you the what we have already in place for program and not yet finalized the venue. We know that it's going to be in the city of Porto. We want to build up on the tremendous success of the Health Summit, where I was also personally involved there in hosting a number of roundtables. The contents of the Health Summit will provide a good starting base from us to steer the discussions. This is our conference today. We are doing this Holy Grail conversation on the conference on the future of Europe. And then we'll have a strong agenda with opening keynotes by Lord Nigel Crisp, a good friend of Portugal that is going to visit us again in the fall. And we're going to create a future such conference, definitely in this space of thinking about what could be the future of global health and health data. Already opening keynotes, Luís Góes Pinheiro, he could not attend today, is going to be there, and also Céu Mateus, a professor from health economics at Lancaster University, Suzanne Gaunt, she's the president and CEO of the International Consortium of Health Outcomes, and repeating also as a guest speaker from last year, Dr. Jacqueline Conaway, and she's bringing a perspective from future foresight strategy. She's also going to be with us. Raphael Grossman, and a medical doctor and a futurist, is going to hopefully be with us also in Porto to bring perspectives on how to use 3D virtual immersive reality onto the healthcare process, and particularly in medicine. George Matthews, also a medical doctor. I'm sure George is trying to reach us because he's here in the session. Is also going to be with us in Porto. And of course, Lars Montelius is the Director General of INL as partners in this initiative is going to be, and among other speakers that we're going to have in Porto. So the agenda will be for 2 days. 28th of October, we'll start in the middle of the afternoon for the ones who are in the local space of Europe. This will be early in the morning for the Americas, North America, 7 a.m. North America, Pacific Daylight Time, 3 o'clock, 2 to 3 o'clock UTC. So we'll have the welcome and the plenary session. Then we'll have a hybrid knowledge cafe. So it's an interactive session to start off warming up the conversations in this community. And then we'll have a final panel with the conclusions that will be at 5 to 5:30 UTC. This will be 10 a.m. To 10:30 Pacific Daylight Time. So this will be the first day. And then the second day, we'll start on the European round of talks. It's going to be 8 to 9 UTC, an opening plenary. And then we'll extend these hybrid peer conferences to Brazil and India in the afternoon, as we expect that guest speakers and also participants from India will joining us, and as well as Brazil. And we'll have a conclusions plenary precisely at 3 to 4 UTC. This will be noon to 1 p.m. In Brazil. So this is part of an ongoing series of events that we have since last year. And we are hopefully that all the guest speakers here with us today will be also joining us in Porto, and also to have your participations. So that's it for Health at the Forum. And perhaps under alphabetical order, we can start. And Andrea, call out what will have the most important takeaways from this session so far?
Okay, so what I can see from now on, very exciting ideas in terms of also bringing the children along to this with gaming. That's a new thing, which is a very interactive. I was talking here about the processes perspective and technology as well, where we can be more interactive with people. And usually the law is one of the things that lies a little bit behind because of all the numerous words. And when we're talking about these applications, usually we have to click yes or no, agree, but you have a statement of terms and conditions, and not many people read it. So I think as lawyers as well, we have to go past there and be better at communicating with people, with the normal citizen, which people are used, especially children. We're talking about having gaming and interactive games, learning about the digital world from school age. And this is very important for the future. This is very important. And the children today, they want something quick. They are used to these digital gadgets and they want information very quickly. So when we put on a lot of terms and conditions, people are not going to read it. They're just going to click. And this is the truth. So knowing that, how can we go over it? Nowadays, when I'm talking about privacy made easy and being more interactive, is even like with citizens, having like chatbots explaining the things to people and interacting with people and talking about it, giving the answers instead of having statements that we just click. This is something that we should think about. As Ricardo was saying as well. When you develop something, there's lots of even the informatics, they don't have all the knowledge that they should have. So for medicine, for specific areas such as health, and also for specific areas such as privacy when they're developing something, because it's so complex sometimes that one person that is focused on the technology side of things and how things interoperate with one another, they cannot have the whole dimension. So it's the most thing that I've taken from all this is about collaboration, is having different experts and different people putting their heads together and making the next step together. This is what I feel of it. Very good ideas for health, for digital literacy processes as well, creating profiles as well for people, not just in terms of health, but having more regulations in a way that it's that makes it like a journey, like an experience journey. And this is something to consider. But very good ideas on all three areas: technology, people, and processes. Really happy that people are really thinking about it and putting their contribution to it, because only together we'll get over it.
Fantastic, fantastic. Thank you so much for these observations. Perhaps, Ricardo, you want to add in something?
Yeah, I think that's currently we are living in a moment where everybody feels that data should be put to work for themselves, which is, I think it's good, and we are moving from a moment where we were more we thought about technology in the health area as being something that in the future would bring some good things, but now we are more on the level of the necessity. So we want all of these things for now. We need them now, and we get more and more uncomfortable with the idea that all our problems are occurring and we don't have an answer of the level of our expectations. Okay, and this is useful, but at the same time, we need to refrain from making things in a very fast way that won't solve the issues in the future. So we need to take advantage of this stress to make good solutions, not something that will work just for a couple of months and then it will stop working in the correct way. And so I also feel that, and the comments are going in that direction, a lot of concerns regarding security, but at the same time, usability. And this is something that, again, and stressing on something that Andrea said, that's another thing that the developers are not good at. Again, I am a developer myself, and sometimes we need to do everything from databases to programming to workflows and then design. Nobody is good at everything. And I must assure you that a lot of people that do software applications are obliged to make forms and user interfaces, and we are not good at, well, some of us are not good at it, but still we need to do it. And so we really need to have experts on all of these areas and working on this. One last thing that I really think that is, I didn't see this on this brainstorm, so I added just now. One thing that COVID has taught us is that we need systems that are very easy to be adapted. And so new systems need to be made in a way where I can add more data to be collected easily, that we need workflows to change. And so we need solutions that, well, currently we call those solutions low code or no code, but we need solutions that can evolve very easily without having to spend a lot of hours of programmers doing those. So this is something that is not easy. They are harder to do than the other way around, but we really need this if you want to adapt to new realities very fast. Okay.
Fantastic, Ricardo. Remember, you're going to have the final word, so don't leave for the moment. Arthur is here with us, and I'm going to ask him to takeaways from the session so far. Arthur.
I'm just watching the board with all the ideas from the brainstorm session. And I have to agree with Ricardo about interoperability and about data, because of course now we are thinking about solutions, about apps, about IT system, about electronic health records, about infrastructure. But in 10 years, or maybe even in 5 years, but for sure in 20 years, the data will be in the focus on all processes, and everything will be based on data. And we will need a high quality data for secondary use, and high quality data to improve some processes in healthcare, like for example, prevention, or like, for example, epidemiological surveillance. So data will be on the focus on everything that is happening in healthcare, like it is already in other sectors. So we have to think about solution today and interoperability, but also what will happen in 10 years, because this mistake we made already with interoperability at the beginning, because we didn't think about this so much. It wasn't so important. We were fascinated with all these solutions that we had, technological solutions. And what happened now, we have a little bit mess in this area. Yeah? So even some systems in one hospital don't communicate with each other. So it means that we have neglected this topic. I like the idea from the brainstorming session that if we talk about mobile apps, maybe we should start slowly thinking about one app, just like, for example, iPhone has health app, and we could take like a puzzles, other apps to coordinate how they are working together. So the citizens, individuals, they don't have to use so many apps. They don't have to download so many apps. We are a little bit tired of the number of apps that are available. So for every task, we have another app. We have another app for banking. We have another app for communication. We have another app for prevention, maybe another app for a prescription, electronic prescription, for COVID-19 tracking system, for certificates, and so on and so on. I think that people are tired of so many apps having on iPhone or over a smartphone. From the perspective of people, for sure, education. We have to change the medical education approach we have now, because I think that doctors and nurses, they have these programs, access to education programs, same like in 19th century probably. Nothing has changed so much. It's still focused on medicine. And it's of course important because doctors have to cure patients. So medicine as a knowledge is a key. But so many things have changed. Among them, for example, how doctors are communicating with patients online. Telemedicine is not the same as one-to-one contact, as direct contact with a patient. So we have to change it. Doctors and nurses have to learn about IT systems, about AI, maybe even basics of programming. This is something for children that they should learn this at schools. Yeah. Communication in digital age. Doctors have to know how to speak to the patient if he or she can see a patient only on the screen. And from the third perspective, processes, I would like to strengthen once again this bottom-up approach. So healthcare is happening in the communities. Healthcare is happening on the individual level. We have to empower patients, and we have to create healthcare system that is focused on local communities, because health is happening in local communities. We have to connect two now separate systems. That is a social system and healthcare system. So patients have a one transparent journey and one experience. And of course, privacy, but privacy by design. Patient, when using, for example, a mobile app, don't have to read or check all the checkboxes, put all the checkboxes and agree on that and that and that. It should be privacy by design. Without reading long documents, just being sure, okay, my data is safe and I have control over the data that is covered by this or that app. That's it. Thank you.
Fantastic. Thank you so much, Arthur. And I see that Gerard is now off on this camera, but I have here with me George Matthew. from the United States is going to make an interesting, fresh perspective on this. Oh, and Gerard is now back line. So maybe I will invite you now, the two of you, to be in the spotlight and have this contrasting conversation on George and Gerard, the two former speakers of Health Data Forum Global Summit last year, and hopefully also from this year too. George, a fresh perspective from the US, and then Gerard, also some comments on ideas produced.
I hope it's fresh. I've heard most of the people here, so I don't know if it'll be as interesting, but I'll do my best. You know, Artur I think made a very good comment before about trying to encourage health from the communities as well as privacy by design. What we're seeing here, and we saw this with COVID-19 last year when it came to contact tracing apps, you know, Apple and Google came forth after going to the White House and basically told all the states, we've solved it. We have a privacy protecting app that will work on Android as well as Apple platforms. Please sign up. And the sign up rate has never been very good because people, because of whether it's post Cambridge Analytica or otherwise, realized that there was no protection for their data and they didn't feel comfortable using it. And that hamstrung us here in the States, and it still is, because we don't even really have a GDPR in any way here. Many of the privacy laws are state by state based, and it's eroding trust not only in these technologies, but in some ways the healthcare system itself. So, you know, whether it's for COVID-19 or healthcare in general, we do need major reforms, not only in how we deliver care, which I agree totally that we need to redesign it from the bottom up and actually encourage peer-to-peer and community-based health with some support from healthcare professionals. I'm an internist myself now. I practice part-time. And what I'm seeing with patients now is, in many ways, they are very digitally educated. They're used to looking things up. They ask much more intelligent questions than even 5 years ago. And they need the tools to be able to make the proper decisions, where we as healthcare providers can become trusted advisors, not just paternalistic, do what I say type folks. As for the design that needs to be underlying it, and this goes to how data is obtained, we have, just like with apps with end user license agreements, which pretty much sign everything away to the company that puts it out, consent in many healthcare systems and hospitals and payers here is also fairly global. And I think patients are now noticing that many of these healthcare systems that they go to for care that they pay for are now using that self-same data to now make digital health companies or sell the data directly. I think it is going to come to a head here, and ultimately we'll have to come up with more transparency and differential consent models that allow people to fully understand what they're signing up for. The recent World Health Organization document that came out on AI and healthcare specifically highlights that there is an inequality, almost an arbitrage opportunity for many organizations where they get people to consent to give away their data, but the information asymmetry is so great that people don't understand what's happening. But as more and more of these observations are being made, people are beginning to understand what's happening and how their data is being monetized and used in some ways against them. So that'll have to be reformed and change as well. But ultimately, I'm in agreement with what people have been saying up until now. We need to make a change, and it has to happen soon.
Fantastic, George. And Gerard, how about your complementing view on this?
Well, I'll start with teeing off with what Andrea said. I mean, we need to make things simple, right? And simplicity is going to be the key. The other thing is going to be empowerment, right? We need to really empower people to make their own decisions, to take control of their own health. You know, right now with wearables and graphene-enabled patches, we can collect a lot of vitals with different devices that can be correlated and aggregated and effectively and efficiently, parsed and viewed. And I think that we can know more about our health by really taking all these different samples with the different technologies that are available. I think from a GDPR perspective, we're going to be okay in Europe because it is strong. But I mean, as I said before, it needs to be united in a concerted effort to make that happen. The third element of that will be when it comes to the empowerment. I really believe that nutritional medicine is going to be a bigger deal, especially considering of how many people that have been asymptomatic with COVID or have had COVID have gastrointestinal problems and other types of issues. I really believe that our monitoring our gut and understanding what we eat and how it agrees with our system, which is very different from person to person, will make a huge difference. So eating better, wellness, all of that combined will make a gargantuan difference to our health and how people can be empowered to make a difference for themselves and their families.
Fantastic, and thank you so much, Gerard. And it's a pleasure to have thought leadership in this conversation here shared. So we are now approaching last minute of our live broadcast, and as promised, our panelists, just one word only as a major takeaway from this conversation so far, and alphabetical order: Andrea, Arthur, and Ricardo. So one nugget from this conversation for cutting the transmission now.
For me, it's not easy, but it's not impossible. So we can do it.
Thank you so much. Arthur?
Health literacy from my side.
Fantastic. And as promised, Ricardo, your final word.
I would stress on quality data for life.
Fantastic. Thank you so much, everybody, for joining this session. Thank you so much, dear guest panelists, for taking these 2 hours of your busy lives to be here and volunteering, sharing all this knowledge and information. Thank you so much, all the Zoom participants, but in particular, George Matthew and Gerard Bourbon, and glad that you could show up your video feeds and share with us. And hopefully let's meet again in persons or not in Oporto, 28 and 29 of October this year. Goodbye for now.